We welcome you back to our program, and we join again Dr. Thomas Hirose joining us on the program. Hey, Doctor, welcome back to the show.
Good morning.
Good morning. We are learning more and more from you about our blood and, that life-giving fluid that flows through us all of our life. And we only see it occasionally if we, are having a medical procedure or donating blood or maybe cut ourselves, we see it. But normally it's inside where it's supposed to be and stays inside. But we've been talking more about some of the things that make up our blood, and while it usually comes out, it's just red, either light or dark red, and then as it hardens and makes the little crusty part and scabs over, we sort of forget about it. But you, as someone who specializes in this area, really you look at all the different components. There's a lot of things that make up our blood.
Yes, the blood, which we call whole blood as it comes out, is very complex. And we like to say that it's similar to a liquid organ transplantation in its complexity. And it certainly has many different parts. You have the clear section, which is the plasma that contains clotting factors. It also contains enzymes that help stimulate growth of other cells. Those are called cytokines. You have the red cells that support oxygen delivery and nutrients. And then in between, you have a whole host of cells that their color is white, so we call them white cells. But they also include the platelets, which also help us stop bleed. And what's become in the limelight in the last 20 years is this is the layer that actually contains the stem cells. So very famous Nobel laureate E. Donald Thomas found that you can transplant kidneys from one person to another. And then from that work came stem cell transplantations to support people with cancer. And from that, we discovered that the stem cells not only are in the bone marrow, inside bones, but they were next found circulating in the blood. And so for a period of time, we were collecting those cells from volunteer donors or from the patients through blood collections, through the blood. And then lastly, just recently, we found that there are stem cells that are located in every single organ. So the next discovery was that in a discarded product, that being the placenta after delivery, that's the afterbirth, is rich in stem cells. So then became the blossoming of cord cell collections for the baby itself or for random use. And so that's been a big thing.
And I know many doctors now, that's part of the delivery process, part of the birth plan process, is that retaining those things and maybe using them for help other people, or maybe even help that person in the future with, as of course stem cell research is now kicked back in with a bit of a political change in the thinking on that. I know right across the street, right up the road from us at UCI, they're doing lots of things in that, as well as other medical situations, and whether studying stem cells and how they can help us. When you've been on before, we've talked about where the blood comes from, and it's voluntary donors.
Yes.
And of course, we learned the other day about the new collection center right over there at the hospital, which is opened up now. But they tell us when we donate blood that you're not just helping one person, you're helping maybe possibly several people.
Yes.
And that's because you spin things off from it?
Yes, and so we can use the gravity of the Earth, called 1G gravity, to separate out the clear liquid to separate plasma from the red cells, or we can put it in a centrifuge and actually take off the platelets, take off the red cells, and take off the plasma, so potentially 3 people can be saved by this product.
And I've heard of people who, rather than donating whole blood, do what they call donating platelets.
Yes.
How does that work?
With technology, we've discovered faster and more efficient ways to target the components of the blood. So there is a machine, and they are a variety of sizes. Some as small as a toaster, very small, that could be actually transported to a company for local collections, to as large as this monitor next to us. And the technology is fairly simple. Blood comes out of an arm.
Like a regular blood donation?
Like a regular blood donation. It goes into a machine, and the machine is a centrifuge. And the centrifuge then separates out the liquid from the red cells and the white cells in between. And the machine then can selectively take out the red cells, or the white cells, or the platelets, or the plasma. And in so doing, you can have directed donation in any one of these components.
And then I understand sometimes they actually take the platelets out and put the rest back in.
And that's an amazing story because the red cells take a longer time to regenerate, whereas platelets are made and produced very quickly. So we can take out a dose that can save a patient, and within several hours, the body makes those platelets back.
Right.
So that means that instead of 56 days for red cells, a platelet donor can come back in 4 days and continue to collect and donate platelets.
Right. We've talked about this before. We've seen TV shows like MASH or war movies where somebody will be injured in battle and they'll have them in the hospital, the tent there, and they'll get one of the doctors or one of the nurses the same blood type and they'll volunteer and do a direct transfusion. We don't do that much anymore than major, maybe in third world situations or emergencies. That's really not done for safety reasons.
That's correct, because it takes about 24 to 48 hours to do all the testing for infectious agents such as HIV and hepatitis.
And of course, a lot of times we've talked about also that people can see the blood being used for people with certain medical conditions. We think of hemophilia.
Yes.
We think of people that have quote unquote low red count.
Yes.
They might have need for transfusion periodically as well.
And there's several patients and diseases that we do think of. One is that, of course, lymphoma and leukemia, where the problem is in the patient's ability to make red cells and white cells. And a typical patient with lymphoma or leukemia may use literally hundreds of units of blood to be supported. There's another big group in this country that have sickle cell anemia where the red cells crinkle up and they clog up the blood vessels, so that when that happens, to exchange those cells for normal cells is a life-saving procedure. And then, interestingly enough, it takes the kidneys to stimulate the bone marrow to make blood. So unfortunately, patients that have renal failure, their problem is that the kidneys aren't stimulating the marrow, so they need support with red cell transfusions, and we give lots of units for that.
And so sometimes when people are getting those filtration processes going on, they might need additional blood as well to supplement their own.
That's right.
In that point as well. Lots of uses for the blood, and again, the new donation facility over there right inside Saddleback Hospital. And of course, a reminder to you folks who are on Coumadin that that's one of your main subspecialties in your practice, is that testing. I know I had a blood test the other day, and I got a call 2 days later from the office telling me the results, which seems pretty fast. This was a lab in Irvine. Your testing procedure blows that out of the water. You do it within 5 minutes.
That's right. We're able to have a patient come in and do a finger stick and then put this into the instrument, and literally within a few minutes we have the answer with which to adjust the amount of coagulation.
Right, especially if you're a Coumadin patient. Very important. That balance is critical indeed.
Yes.
As always, Doctor, we thank you for joining us. Good to have you on the program today. Dr. Thomas Hirose, a specialist in blood donations, and testing for blood situations as well. We'll be back with more as our program today continues. Please stay with us. Good job as always. Thank you, sir.
Dr. Mark Morin, retired physician and patient at the Laguna Hills Coumadin Clinic.
Coumadin is a very effective drug and tricky to control.
If you're on Coumadin, you need to be evaluated by a physician every 3 to 4 weeks. We draw blood in the office and have your results in 5 minutes.
I am seen by a real doctor who evaluates, charts, and controls my doses so I can stay healthy, active, and playing tennis. Be smart and in control at the Laguna Hills Coumadin Clinic.